So let's continue as we finish up for today. So we're talking about the healing processes, our empiricism, the things we've recognized, the patient being involved with the treatments, which is important. They understand the treatments, you explain them, and once again, I love the concept, and this is what we try to really train our docs into, becoming that dental healer. So I'm telling you, there's a whole world of energy, the whole world out there. It's a little bit different than we see on the physical plane. And this is part of the healing process, that spiritual surrender concept, okay? Because once again, healing, if you're healing on many levels, especially if you're dealing with, chronicity, really complex issues, you have to heal on multiple levels. Once again, it's the physical, it's the mental component, the spiritual, and the emotional, the spiritual end, and the emotional end itself. So the trick is, once again, you have patients, and you're all seeing it, that overthink everything, okay? They can't get the hell out of their way. And the way you kind of have to heal, get out of the way. Stop overthinking it, okay? Focus on other things. Let the body do its work. I've seen patients that just my ankle turned 3 degrees the other day, and I think maybe it's my thyroid. Like, oh my God. No, just move beyond that and let the healing process go. And that's sometimes difficult because most of these people, if they're chronically ill and this type of biologic patient you might see, they're scared to death. They're looking for solutions and answers, but a lot of times the answers are less. Get out of the way. And the mind, cannot order healing, okay? And healing is really not per se an intellectual function, but more of a higher plane function by getting that mind, okay, that consciousness out of the way itself. So talk about the mind, the body, the emotions, and of course the spiritual end itself. And for healing, one must surrender to the silence. That's why that meditation is so important. Quieting the body down, calming it down. Taking those few minutes every day, even in dentistry, taking those few minutes every day for just to quiet down, just to open your mind, open your spirit up, okay, your energy field, to calm your system and prepare it and be thankful for every day that you're here, that you're able to take care of humanity and yourself. But one important thing is the energy of love, right? Don't you feel the love today? Yeah, you feel it. I know you feel it. All right? We feel that love. And you know what? That's so important. I mean, people that have supporting loved ones around them, they might face some challenges in life, but they have that support, that love, that energy. They do so much better in life versus the ones that are alone out there, that don't have a support system. And it's tragic at times to see that, but it's just the reality. So this is from my dear friend, Dr. Ali, once again. It seems improbable that man will ever fully understand the healing energy of love, or to be more precise, the healing energy of God. Medical technology itself is an expression of God's energy. It's beginning to allow us to measure some things about love, and then reproduce them. Measurement and reproducibility make up the language of science. But one day it seems to me the men of medicine and the men of spirits will meet at some summit of union. The energy of love will have brought them together. And this is something that you do. You love what you're doing. I hope you love what you're doing. And that's an expression of everything that you do in your daily practice. It makes a significant difference. I was kidding around before. I said to my wife years ago, practices with me, I said, man, the day I walk in here and I said, this sucks, I'm done. Monday morning it's like, oh. But once you get there, hey, you're happening. See your staff, your patients, and everything is humming along. And you got to love what you're doing. You really do. And that makes it, and it shows. It shows on what you're doing. So when you talk about human biology, it's the ultimate web of webs. It really is. I mean, it's a vast and intricate network of energetic molecular pathways and interactions, okay? Remember, everything is connected to each other. There are no separate pieces in the human body. And it is a kaleidoscope. One thing changes, everything changes, okay? It's like, you hurt your ankle, you're looking like this. A couple of days later, your hip hurts. Then your shoulder hurts. You're zigzagging all over the place. So it is one thing, and it is that kaleidoscope. But when you get into the biology and these deep core principles that are underpinning this health and wellness concept, we have to think about the cell a little bit. And I talked about the epithelial cell in a slight manner before. So when we think about the cell itself, we're dentists. I don't want to think about cells. I think about teeth, jaws, whatever the case may be. But the cells in your body are a reflection of the environment they live in. They reflect that ecology. Once again, simple things like, let's say, periodontal disease. You see how the cells change and morph into, trying to resist or hold on to an acidic, anoxic environment as they change and become basically starved. And how did they become starved and poisoned themselves, okay? So all the cells throughout your whole body, especially epithelial cells, will transform or change slowly based on the ecology they live in, okay? Now, based on that, I know last night you're all excited being here. Griffin Cole was going to speak, so that draws the crowd in madness right there. We always think, how did oxygen get to a cell? How does that happen? Nutrients get to a cell. How does the metabolic waste removed from the cell, the poop and pee, okay? And what is the cellular ecosystem and what is the cellular matrix or terrain? And this is the basic for biologic medicine and dentistry. So we were taught in a very linear fashion. Think about dental school, very linear in fashion. Okay, that's for sure. You're here, you're taught to the boards, you pass the boards, okay, bye, nice knowing you, okay? Even in medicine, you go back to virtue, all the things we were taught, okay, where everything's a machine. You fix the machine, you're better, okay? Here's the drug, turns the key, locks up, oh, I'm cured, I'm better, okay? And that can be objectified. But the reality is what we're dealing today with is different. Linear model really doesn't work for chronic disease, and tumors. That's what we see a lot today. How do you deal with that? And, we're not having much success. The war on cancer, well, I don't know if that really worked out. So in the integrative model, we're looking for what is the root cause of the disease. You look at a patient and, you do all the great things with their teeth, their gums, your perio, oh, this is great. They keep on losing bone. Why? Is it the occlusion? Well, let's screw around with the occlusion. Occlusion seems okay. Tissue's not bleeding. Well, where's the degeneration of the bone? What pharmaceutical are you taking? Uh-oh. There's close to 300 drugs that have fluoride in them now. Triatomic fluoride attached to these pharmaceuticals, and they're taking. So I had a biochemist from one of the pharmaceutical companies come in and says, what the hell are you putting fluoride on the drugs for? Well, we think it makes it absorb better, and we got to get rid of it anyhow. It's like, oh, shit. Crazy, man. Crazy. So what's the core issue, okay? What's, of course, the patient's, experience through this? Once again, trying to figure out that biologic underpinnings that goes on. So biologic systems are different. They're not linear. They're not linear at all. They ebb, they flow, they change, okay? They're interlinked, okay? Your body flows energy to support certain things and moves it this way. You heard about Chinese Qi medicine, the energy flow. We just happen to be an energetic being, once again, trapped in this little meat suit we sell. So, most important thing in biologic systems is information. This is the essence of a detoxified, clean, healthy body. It's communicating and talk to itself in a clear fashion. That's why you hear about the pituitary, thyroid, adrenal axis all the time. Okay, these are information highways. Your body has to be told what to do. Now, if that information is not correct, is not getting to the cells itself, okay? And there's a way it gets to the cell. But it's getting there. Things change. Things change. And epithelial cells are they're loving little creatures. They love to cuddle. They protect you. If their friend's not feeling well, they'll share a little food with them. They do all wonderful things. But also at the same time, they need to be told what to do. And if they're told the wrong thing, they'll start making weirdo proteins, like if you get in messenger RNA, and you start producing really weirdo proteins, and things change at the cellular level. And remember, when you see a disease state, we'll talk about that in a minute, disease state, that didn't happen yesterday. It's like the patient, my God, I got cancer yesterday. No, no, you probably got it maybe like 10 years ago. And it just eventually got to the point where we're seeing it manifest on the clinical level. Same thing with periodontal disease. I just got periodontal disease. I got bone loss. I got that yesterday. No, you didn't. When was the last time you went to a dentist? I don't know. Have I been to a dentist? Okay. So those things, don't happen yesterday. So what's important is, once again, information is the key. Now, in a toxic, acidic environment in your ecosystem, information is not going to be traveled very well to the cellular level. We'll talk about that in a minute. So you won't get there and give it the proper information. And all this information, okay, oxygen, nutrients, water flow, has to go through what's called the extracellular matrix. So when these people are detoxifying, if someone knows how to detoxify properly, the first thing they do is detoxify. They get in their guts working, but they detoxify what's called, once again, the extracellular matrix. It's that interface between the cells, the vascular and lymphatic system. The matrix is a unifying theory. I have a slide on that, of the entire body. The entire body is controlled, per se, through this matrix itself. Water flow, nutrients, oxygen flowing in an intelligent manner to the cells, and from the cells back out in an intelligent way. Capillaries don't go, cells say, I need some oxygen and some food, and they go over and rub up against a capillary. No. It sieves out, and I'll show you how that works. But once again, it's important that the body speaks to itself. And this is, Tesla was ahead of himself, and this is how the body talks, through language or resonance, how you resonate, okay? Your body resonates all the time. I think we lost our sound. We gained it. So your frequencies, that's why you look. That's language in a two-dimensional way. Your body has three-dimensional frequencies and resonance like that. This is how it communicates. It's called what? Cytokines. Your body speaks in cytokinese. And what's important is that there's a great book called Power versus Force, one of our textbooks we give to our students, because it really talks about the concept of resonation. We all resonate at different higher frequencies, depending on your intellect, where you go, spirituality, whatever the case may be. But it's important that these energetic forms, travel through the body in an intelligent, coherent way so your body can interpret that. Because it's amazing, if you look at your basic biology again, how the human system really works. And it really works through that extracellular matrix. It was really developed and understood by Dr. Alfred Pissinger, an anatomist histologist a number of years ago. So what this matrix is, and this is the fundamental for basic biology, basic biologic medicine and dentistry. So the matrix is really, the biologic terrain, which is your ecology. Every function, and every process in the living body involves the matrix in one way or the other. Like I kind of briefly said before, everything in the body that flows in and out of the cells is regulated by this extracellular matrix. It's totally autonomic. It has its own, once again, brain. There are different little brains around your body. We think about the sympathetic nervous system, parasympathetic, the enteric nervous system, but also the nervous system that serves the extracellular matrix. If you took everything away in your entire body, except the matrix, you see a perfect outline. This is the highway of information, and that interface between the cells and the rest of the body itself. So the matrix, it's really the unifying biologic system in the human body. When I said before, you stick that patient with that needle, well, how their little toe feels it is through the matrix itself. Highly regulated autonomically. Think about the innate intelligence, the entire body in an intelligent way, allowing the full flow of all those molecular biochemical elements flowing back and forth, water going back and forth, oxygen, nutrients in an intelligent way. It's absolutely, absolutely amazing. And this matrix is made of all different type of proteins and collagens, supporting structures, guide paths, water sieves, elastin, all different type of stuff, And it's amazing how this works, and I'll show you a nice little video of it in a minute. So the current scientific thinking, once again, it's a complex ordered aggregate composed of a number of different macromolecules whose structural, enteric, and function composition are important in maintaining normal function. Okay, great. What does that really mean? Once again, simple diagrammatic representation. We can see the cells at the top here, and here's the vascular beds, lymphatics, neurons through here, this highly controlled, highly regulated interface between the basement membranes and the cells themselves, Well, that's an okay representation, but what you have to appreciate, say this is how they're developing actually artificial hearts. They're building the matrix first, and then on the matrix go all the muscle tissue itself. And also appreciate the fact that cells themselves are not these flat little sheets of stuff. The cells are totally interwoven into this matrix itself. And remember, this is, as mentioned briefly, about the concept, you hear about eating good oils, like olive oil, all these different oils. The purpose is that you remember all your cell membranes are made up of what? Phospholipids, Now, if you eat good, healthy oils, those oils are incorporated into cell membranes, and the cells can resonate and much more flexible, which will allow easy transport of macronutrients and information into the cell. When you eat at McDonald's and all this stuff, hydrogenated oils, your body's going to use what it has to, and it makes rigid membranes. It makes it much harder for the cells to function and get the nutrients that they need. And those little transport mechanisms, which we'll take a look at right now. So right now we're inside the nucleus of the cell. As we're seeing this, we're traveling out through the cell, endoplasmic reticulum, cytoskeleton, all these different structural things were coming out. and we're starting to go into the matrix itself. Now we're at the matrix. We see the vascular beds, lymphatic system, all those macronutrients traveling around in a clear, coherent fashion. Where's the intelligence of a cell anyhow? Where's the brain? Think about that for a minute. We see water molecules, all these structural supportive structures. This is going on in you right now. This is you. So this pathway, this area, when people take in these homeopathics, the drainage, and there's all different kind of homeopathic, we're stimulating cells that detoxify. Can you imagine if this is toxic, has heavy metals, toxins in it, then you give something, tell the cells to start pooping and peeing a lot, and there's no place for it to go. That's why this matrix, when they detoxify, is one of the primary things you clean up also before you get at the cellular level and do the detoxification. And you have areas that reserve different macronutrients and hormones, et cetera, to hold on to them, release them when the body needs it in an innate, intelligent way. As we're working our way down, there's structural proteins, collagens, et cetera. Start to come down a little further. Now we're coming down to the cellular level here. And you can see those phospholipids are resonating it, okay? And you can see those transport systems are active and passive transport mechanisms that easily take material in and out of the cell itself and deposit it up and in and out of the matrix itself through the membrane. And we go back down. The nucleus itself with our DNA and chromosomes, all kind of cool stuff. What is the purpose of that? You know, for years we see the little round ball there and say, where's the brain of the cell? Oh, the nucleus, because it looks like a ball. It's like a brain. That's a protein factory. That's how this theoretical vaccine's working. It's sending messages into that DNA that make some weirdo proteins that are toxic as hell. Okay? The intelligence of a cell is at the cell what? Membrane. That's where the intelligence of a cell lies. Because it intellectually has the transport mechanisms in and out itself. So when we talk about disease, whether it's periodontal disease, cancers, or whatever the cell, most of these problems, if not all, start at the matrix cellular level, obviously. Okay? So we get abnormalities in the extracellular matrix. The cells aren't getting the proper information. They're getting the weird information because it's toxic as hell. And what happens? Your cells start producing weirdo proteins and it evolves into some kind of bizarre disease. It could be cancer, whatever the case may be. But as that matrix collapses down, we don't clean it or detoxify it. Of course, we're going to get the cell biology is going to change. Okay? Things start to change. We don't see that. You don't even feel it. Then eventually things start to drift. The ecology starts to drift and eventually evolves into what we call disease. So what you want to do is detoxify, clean your body, get the matrix, and learn how to do these things. And it's a lot of fun, keep you a lot healthier. So in functional life, we talk about the capillary, the cell, and of course the matrix itself. And we have, in dentistry, we got an incredible matrix. It's called the dental pulp. You think about the tooth. Inside the tooth is all lined with what? Odontoblasts. Remember that from dental school? Making dentin. Okay? Well, who nurtures the odontoblasts? The pulp. The pulp is really a super modified what? Matrix. That's it. So the tooth has a very complex, beautiful matrix supporting the odontoblast, and of course creates all kinds of havoc if you need a root canal. Root canal, don't say that. Okay? So when you talk about factors that influence cell biology, we talk about the matrix factors, the chemicals, the growth factors, cytokines, hormones, vitamins, how cells contact each other. We talk about leaky gut syndrome. People hear that today, and Crohn's, all this kind of chronic inflammatory leaky gut is when what happens, especially in the large intestine. The epithelial cells are being starved. There's something's not going right. They need more butyrate because that butyrate butyric acid is what? Large cell, large intestine cell food. They separate apart. That conjunction of the epithelial cells open up, and what? Allows for infiltration of bugs or viruses, etc., and you get a lot of gut problems. Okay. Of course, once again, with growth, shape, and different type of differentiation and development of the cells themselves, that creates all kind of different health or pathologic changes itself. So once again, cells in, stuff out, regulated by what? The matrix itself. When you get into the concepts of homeopathy, different herbals, etc., this is the foundational things you learn. Once again, when you're pooping, you're peeing, doing all that, but in a deeper sense, the next level is detoxifying, clearing that matrix out so the cells can function at a higher level. So you have all these things, It's amazing that we can function, all the things we do to our body. Try to be, eat clean, do this and that, but, we beat ourselves up, jump off of stuff, break things and all that stuff. But you know what? Your body always wants to go back to homeostasis. It just can balance itself out. So it has this great ability for what's called biologic elasticity. It can take a hell of a beating, but bounce back, that healing process itself. Storms, droughts, whatever, it can bounce back to a certain degree until you eventually, what happens, you give up the ghost. So it's amazing when you think about human biology. All the craziness, all the what we call the unstable stuff, and like George Carlin would say, sometimes we have too much stuff, okay, too much stuff, We've learned how to control that stuff and keep it stable. But, once again, the accumulation of, petty misunderstandings, that can throw the body off and accumulates till, you know what? It just tips over. It's like the garbage can. You take out your garbage, you put the garbage in the can. Take it out to the street, the garbage dudes dump it, but leave a little garbage behind. Do it again, week after week. Less and less garbage is put out. Here's a fine doctor, ladies and gentlemen. Round of applause now. Yay. Anyhow, until eventually the garbage can spills over. And we call that, chronic illness or disease itself. And in dentistry, boy, I tell you, we got the good life. Ooh, we're good, We got chemicals, we got solvents, we're dealing with people spitting on us, infection, heavy metals, environmentals. Who loves methacrylate here, okay? Everybody play with that? I know you did shots of that stuff in dental school, I can tell, okay? So, dentistry is, a little complex. Think about our aerosol world, okay? Spraying everything. Think about, I always figure this, after about 25, 30 years or when you retire from dentistry, maybe that building should be condemned. All the mercury and all the kind of crazy stuff that you do, once again, it becomes quite an environment. That's why we have to protect ourselves. And that's why you see dentists that are just drilling and filling away after a few years of walking around. Okay, ooh, okay, oh, you must be a dentist, huh? What? Anyhow, is this Seattle? Anyhow, so what we want to do is think about ecology, ecology itself. We have this, anaerobiotic, meaning this oxygen problem, dysregulated environment. We see it in the oral cavity. And that's a result of mixed infections or whatever the case may be, and we want to ecologically shift it. We want to change ecology in the oral cavity to it's a well-regulated environment. We want the bugs in there to be, less aggressive. So we want to, get those washed out of there. We can use all different type of techniques and maintain a somewhat, I call, an immature state of the microbiome itself. We don't want to let it sit around and become stagnant and problematic. And once again, we see this problem with oxygen metabolism, acidic development, inflammation, where we see, ischemic diseases. We see chronic infections from root canals, periodontal disease, crisis ischemia, the vascular beds collapse on themselves, and we wind up with these different particular problems within the jaw cavitational issues and jaw infections themselves. So with our integrative, biology, we're using ozone, drainage remedies, direct infusion, et cetera. We're going from this dysregulated environment, we're shifting it ecology, cleaning up the environment having the patient do their homework, and get it back to a regulated environment. And once again, it's important is that the human body is an open, energetic ecosystem. Don't forget, thinking differently, beyond the mechanics, it's all about biology, it's about ecology. You are a little pond, okay? Keeping your pond healthy is the key, And we see, once again, these pictures I showed you before of osteonecrosis of the jaw. This is a result of contamination and poison. Bisphosphonates, what do? The osteoclast, bone metabolism is amazing unto itself, all the cool things it does. Those poor osteoclasts come in, think they're doing a great job, they're coming in, it's time to replace the bone. Okay, everybody, yay. They come in, like little, flying saucers come in, sit on the bone and start creating what? Protons, acid, dissolve the bone. As soon as they do, they absorb bisphosphonates, and they get poisoned, and then they drop dead. So now what happened? Your total bony ecology has been disrupted. How the hell can that heal? It can't. It can't under normal circumstances. And once again, you get things like this. You can't antibiotic this away. Okay? You can't steroid it away. This is where integration comes in, where ultimately we're re-educating the epithelial cells. We're opening up the vascular beds. One of the side effects of ozone is the production of what? Nitric oxide. Open up the vascular beds, restore lymphatic drainage. But these are pieces of the puzzle. This is where you put the patient on lymphatic drainage remedy. Make sure the nutrition is good. Maybe include hyperbarics, okay? Direct infusion of ozone. Making a tray, suck down tray over this wound and have the patient load up with ozonated oil every night. Keep it clean, okay? All we're doing is supportive therapies. We're getting pieces of the puzzle together, working with physicians, okay, to get this patient the possibilities of healing. So once again, biologic, based therapies go from a dysregulated environment where the cells don't know what to do. They're poisoned, they're dopey, they're barely holding on to where we can slowly, ecologically, once again, helping the patient heal themselves to getting a regulated environment where information's flowing in, blood flow, good blood flow in, good blood flow out, lymphatics in, lymphatics out, in an intelligent, innate way, okay? So ultimately, what we try to do with these integrated therapies, make sure they're safe and effective, okay? Non-toxic, all right? Minimal to no side effects itself, okay? Synergistic with the patient's own biochemistry, physiology, and anatomy, and support and enhance the patient's inherent healing processes, okay? And with the ultimate outcome to reach a state of biologic homeostasis, balance itself. And this is where the beauty of integration comes in. We have all different pieces of the puzzle. You can have integrated biologic dental medicine, hydration, nutrition, underpinning the extracellular matrix, oxygen, ozone, naturopathic, allopathic medicine, detoxification, and drainage. So learning these little pieces of the puzzle, because there is bad news. I don't think there's the ultimate one pill cure for any damn thing. There's so many factors. Ultimately at the center of this is the patient itself. But they have to be their own best advocate to do the work themselves also itself. So the pathway to wellness, we want to repair, restore, and renew. That's for sure. So when you talk about the integrated biologic dental medicine philosophies, understand and assess the patient. Start therapy slow and low, and it allows you to understand functionality and responsiveness of the patient. A lot of patients don't overwhelm them. A little bit goes a long way, and that's another trick. There's a term called hormesis, and this is another interesting term, where they found now that less is more. That's why homeopathy, these other remedies work, and even ozone works that way, where we used to have these high concentrations, and the body goes, I can't handle this. Where a little bit goes a long way, hormesis, okay? So that's very, very important. It's an interesting term you can look at. It's a whole textbook dedicated to that concept, where just a little bit your body's interpreted. They're even seeing it with these chemotherapies today, where they realize just a little bit goes a long way versus just trying to like bomb you out. So once again, we want to support the healthy tissue. That's important, okay? And clear pathways of drainage and create a biologic gradient. In other words, making sure you're pooping and peeing right, okay? And of course, reduce the toxic and infective titer, and then eliminate that foci of infection in the tissue itself. And let the patient, allow the patient will, of course, return to that basic homeostasis itself. And of course, the homeostasis is really that cytoprotection, biologics, the ecology, symbiotics, working with infection, and structural and functional. All these little pieces of the puzzle go back to homeostasis or balance of the body. And the body will find that happy medium. It's amazing, once again, how much of a beating the body can take, but with the proper nutrients and support, it can find its pathway back to healing. And remember, age is not a disease, that's for sure. I keep reminding myself of that. So once again, we kind of define this once again as integrated biologic dental medicine. Define a dental medicine that partners with the patient and dental practitioner to develop and integrate biologically safe, effective, established, emerging treatment modalities. And this allows for treatment that is not subservient to one school of thought. Don't ever get locked in and blocked into anything. Be open, be open to everything. And of course, with an open mind, anything is possible. That's for sure. That's my dog Henry with his favorite toys. Okay. So, get educated. Okay. Study, go back to the basics, which I never thought I would be, but I do. Anatomy, physiology, biochemistry. Attend these meetings because you have all family here that will share. Get in a certification program, whether us or anybody, that's really up to you, and that's really important. One of the fundamental books that everybody loves, this is the first book we kind of torture our friends with, is the Extracellular Matrix and Ground Regulation. But that's the essence of biologic medicine, that book. It's one of those ones you go through like, oh, God. Then you go back again, oh, I see. So it's one of those you go back and revisit it periodically. And there's all little beautiful nuggets in there about the basis for biologic medicine. And that really applies to our world. So with all this kind of stuff, what are the rewards for what we do? Well, why I spend time in, and resources becoming biologic. Economics, you will always be busy. You will always be busy. Believe me, the signals go out, the energy field goes out, and they give you the woo-woo wave, and then here they come. You'll make some money, more money, and with seeing less patients. Griff was great at that. With seeing less and doing more, less stress, better relationships. You don't have to see 20, 30 patients a day to make plenty of finances. And supporting your patient's pathway to health and wellness. Intellectual pursuit. You're thinking differently. You're thinking in a healthy way, a mindful way. And you just be transcendent beyond a human mechanic. And once again, that concept of becoming a dental healer. You say that in the typical dental world, they think, you're like out of your mind. It's kind of like, amalgam. Take that out? Ooh, don't do that. Anyhow, so you're a dental healer. But you're doing that, you know what? You do heal yourself. It's a different way of thinking. And you'll have a network of really like-minded people, and you'll have it here and throughout, which is always you can turn to any of us, and we always have great advice for you on patients, et cetera. And of course, once again, it's a different, it's a matter of ecology. Once you think a little bit differently, okay, and this is what I'm trying to give to you today, not the mechanics, you don't need that. It's just thinking a little bit differently, thinking ecologically, and thinking biologically. So with that in mind, we still have a little bit of time, I hope. Yes, good, perfect, okay. So healing dental-related disease with what? Oxygen and water itself. So we saw this slide before, muscle pain, all the kind of weird things in dentistry. There's so many levels of discomfort that causes the effects. It's sometimes complex. I mean, physicians will hate dealing with head and neck stuff, But that's our world. Because, when you deal with it, we're dealing with muscle pain, myofascial pain dysfunction, temporomandibular joint, nerve pain, our favorite, tooth pain, pulp exposure, dental caries. Can we do pit and fissure sealants properly? Okay? And of course, dry socket, which, is always entertainment for you and the patient itself. Periodontal problems, okay? So can all of these diverse problems be treated with dental ozone? We're going to talk about that a little bit now. Yes, it can. All those particular issues can easily be treated with dental ozone, especially things like pulp exposures, etc. Teeth can heal. It's a miracle. In dental school, teeth can't heal. Where do you go? You nick a pulp horn, endo, get out. Okay? Well, once again, we are but one thing, and we're dealing with infections, of course, that we spoke before, of our acute, chronic, viral, whatever the case may be. It doesn't matter. With ozone, it doesn't matter what the hell is there. It will eliminate it. So all these things can be effectively eliminated, as we saw before, by all these different modalities. Okay, antifungals, antivirals, antiparasitics, and stuff like that. I don't use really that much anymore. Antiseptics, oil extracts, homeopathic lasers, UV light, and of course, oxygen, ozone. And this was, for me, my experience in oxygen ozone started back in 1998, 97, 98, when I was working on integrative medicine. Dr. Hutto, Doug Hutto, Mike knows, and introduced us to ozone. How we did it, we're doing ear candling. Great technique. Little candy cone thing, you stuff in your ear, you light it up. Feels great, clears out ears infection. Then he says to us, well, now we're going to do ozone treatment. And we're like, what? That will kill you, So we put these stethoscope things on. He had this little box there, and it's like, brrr. And of course, being dentists, we're more concerned about where we're having lunch in Washington, D.C. So we do it, we survive, okay? And we're down in Union Station having lunch. And we're sitting there ready to have lunch, and like, man, you smell ozone? And I said, yeah. I said, holy crap, it's coming out of my skin. What the hell is that? And so it wasn't really, because ozone has a propensity, has a certain electrical charge that follows inflammation and infection. So sinusing, traveling, everything else, we smell it in our nose. I go back to see Dr. Hutto. I said, what's this all about ozone? It says, is this any science behind it? Oh, yeah. He hands me a good friend of mine now, Renata Vibon's textbook on ozone therapy. And I read it. I'm like, oh, my God, they're treating arthritis, diseases, everything successfully with this amazing, the science behind it. Why the hell aren't we using it in dentistry, where our world is what? Trauma and infection. Okay, simple therapy. So I worked out a lot of the protocols. It was great because at the school we were at, we can experiment on our fellow students. That it worked out very well. And where we are 20-something years later, and thousands of dentists we train worldwide. But anyhow, so with oxygen ozone, it's really kind of like a paradigm shift in dentistry. It's a very simple thing to incorporate, but becomes an integrated part of how you practice. So basically some fundamental scientific facts about oxygen ozone by a friend of mine down in Cuba. Has great disinfection properties, a strong oxidizing agent. If you took 1 cc of this gas, 99.5 to 99.7 or more of that little cube, that cc of gas is what? Oxygen. Very, very little micrograms of ozone are present, but it's so reactive, okay, with that's all you need. Now, it creates basically peroxides. Once you introduce it into the system, ozone instantly disappears. And, of course, you only infuse gas into the tissue. Why? Because it's oxygen and ozone, or energized oxygen. It instantly goes into solution. The physics are different from, you're injecting air. What is air? 80% what? Nitrogen. Different physics. This instantly goes into solution. Ozone instantly disappears, okay? It's triatomic oxygen. What happens is, as soon as it's introduced into a biologic system, it reduces down to diatomic oxygen and what? A singlet oxygen. That singlet oxygen produces a cascade of peroxides, hydrogen peroxides. Those are called the reactive oxygen species. It's the peroxides that do the work of ozone. Ozone comes and goes instantly. It's the peroxides. And the commonality is of whether it's parasitic, bacteria, virus, whatever, is that the peroxides itself destroy the cell membranes. Okay, oxidize the cell membrane because the bugs do not have, or very little, or any antioxidant systems in their cell membranes. So there's no way they can resist the peroxides. There's no way they can develop a resistance to this. Okay, so no matter what the pathogenic form is, it'll be killed by the peroxides themselves. So as a disinfection properties, of course, it's non-toxic wound healing at the appropriate concentration. And that's good, where less is more, okay? And as a result, we get improved and accelerated wound healing. We were talking a few minutes ago about extraction sites. I love to do, you make ozonated water. It takes 6 minutes to make ozonated water. It's self-limiting. Freeze it. Make a bag, I make little bags up, Ziploc bags of frozen ozonated water. I take an extraction or surgery. I can break it up in little cubes. I let the patient melt the ozonated water on the wound site. I tell them 5 times a day. Okay, it keeps this wound super clean. Doesn't cost a damn thing. And they excel within a week. Oh my God, it looks like it's 3 weeks down the road. Because you want that epithelium to migrate over and heal. So you can put your PRF, whatever the hell you want, your grafting site. Okay, with accelerated healing. Something as simple as that. You can use ozonated oils too. Olive oil. Much more expensive if you want to do that. Some cases we do. But the ozonated frozen water works perfectly. It entraps the ozone in the water molecule. Now, the way, I've done a lot of research with the water companies around the world. So I always just ask, what the hell's ozonated water? What does that mean? Basically, the triatomic oxygen carrying a slightly negative charge is trapped in a hydrogen molecular cage. Okay, this is kind of how homeopathy works too. The hydrogen molecules are what kind of charge? Positive charge. So the water actually aligns itself and traps the triatomic oxygen in this molecular cage. So if you freeze it, the ozone's trapped into there until it melts and is released. So that's a nice post-operative way to keep the wounds nice and clean itself. So of course you keep the wound clean, guess what? You get accelerated healing itself. On a deeper level, okay, you get activation of red blood cell metabolism with improved oxygen release. These are for the kind of more advanced type of protocols. You do get nitric oxide formation, I'll talk about in a second. But what happens is there's a 2,3-DPG, there's an enzyme system that allows for the exchange of carbon dioxide and oxygen at a rapid level. Ozone IVs have now been banned by the Olympic Committee, World Olympic Committee. I got a letter from them a couple of years ago because more red blood cells and what was producing from these IVs was called super-gifted erythrocytes. These super-gifted erythrocytes had an incredible capability of oxygen carbon dioxide exchange and also had a high level of antioxidants at their cell membrane. So once again, activation, enzyme system, antioxidant free radical scavengers. The cells themselves, through the matrix itself, sense the oxidative stress, a therapeutic oxidative burst, and they start producing more enzymes. There's basically a protein pathway, which I don't want to waste time on, that tells the cell oxidative stress. What are we going to do? Let's make more superoxide dismutase, catalase, instead of glutathione. And that's one of the really cool keys, because ultimately everyone's trying to get glutathione IVs and all that stuff. No, you really want your cells to produce glutathione. That's where the key to success is. When you do a glutathione IV, that's a superficial kind of cool thing. But at the cellular level, that's what you want to get going at that level itself. And this is really cool, where you have activation of the immunocompetent cells and release of cytokines, interferons, interleukins. But that's kind of cool, because what happens is more information, more coherent information. But ozone IVs themselves have a unique property of modulating the immune system. There's all tons of research. There's like 4,000 articles in PubMed on ozone research and IVs now. A ton of dentistry. I'm editing left and right bunch of these articles. But it modulates the immune system. What does that mean? If you're inflamed, it brings it down to homeostasis. If the immune system is underactive, it upregulates it and brings it back into homeostasis for you. So very interesting, unique property, but that's a result of information. One of the greatest, simplest thing, if you have patients that have herpetic lesions, you can cure that with ozone. Such a simple technique we call minor autohemotherapy. If the patient starts to get an outbreak of facial herpetic lesions on the lip All you have to do is draw 3 cc's of ozone, stick a vein, get 1 cc of blood, you mix it up, you just made an auto vaccine. Because all the information, all the antigens about this event is in the blood, it's oxidized, and you reintroduce it. Now what you've done, you've educated the eosinophils and basophils. They go back into the lymphatic microenvironment, educate the immune system to recognize it, and it short circuits this, and guess what? It doesn't come back. Same thing for warts. If you want to eliminate warts forever, treat them with ozone, stick them with ozone. It creates an auto vaccine. Incredible, simple, incredibly simple, and I've done that for years. Very simple procedure itself. And of course, as a result of that therapeutic oxidative burst, we do see an upregulation of the antioxidant systems at the cellular membranes. We see catalase, superoxide dismutase itself, and glutathione itself. So we do see that, anti-inflammatory effect, okay, or upregulation of the immune system, and increased, circulation of nitric oxide. That used to be called endothelial relaxation factor. So when you inject ozone, you inject only the gas, not water, you will see the whole area start to change because all those vascular beds are opened up, and that's incredible for perio. Incredible for perio because all those vascular beds have collapsed down. And it's very easy with ozone to change the eco-environment. Hygienists that do use ozone, get rid of all the damn chemicals, use ozonated water and gas, and the results are absolutely incredible itself. So we're getting nitric oxide formation, it's all their properties, but it also has a high redox potential. Well, what does that mean? It loves to donate what? Electrons. Okay? So we find cells that, in a toxic environment, all right, their batteries, which they are like little batteries, are worn down. It dumps electrons into them and recharges their batteries. So we love a transfer of electrons itself. So that's some of the properties of ozone itself. So the therapeutic goals in our model, once again, we support healing, nutrition, pathogenic load reduction. By doing that whole thing, the body auto-regulates, auto-detoxifies, and drains, okay? And we love to, integrate ozone into our daily practice itself. How much time do I have? A few minutes? Yeah, but that's another story. So just the beginning, I was lecturing in Egypt a couple of years ago. That was nuts, okay? Wish I had more time on the ozone to show you. I had a little perio thing, but I don't have time. So, there's my little marketing thing. Our next class is forming first weekend in June. And have 2 courses in ozone coming up in Denver and Long Beach, California, May and June. So you're more than welcome to come. I think we have a couple of slots left at the school for this coming year. A lot of our graduates are here, and some of our attendees are here at this particular time. So I had more time. I'd love to delve into a little perio and ozone, but I think what time is it now? It's time? I wish I had more time. It's kind of cool stuff. But so ozone, think about it. It's always good. It's amazing, actually. Thank you very much. Questions? Questions? Oh, that good?
Are there questions? Seriously? David Kennedy's here too from this morning, so we have any questions for him? Or me, or Joe? Is Joe Palmer here? Well, you can ask us Mercury questions too. Any questions at all from today? Yes, in the mic.
For the ozone classes that you offer, they go through like hygiene type of circumstances or doctor?
Any other questions? Oh, she's got a lot of questions today.
So, Dr. Kennedy, I just want to know if the fluoride that they put in the water here in the U.S., is it the same fluoride that Hitler used during the Holocaust?
And so they tell the farmers that makes your tomatoes thirsty, so you put phosphate on the tomatoes so you buy water for the price of food. The gypsum, they put 2 pieces of paper on it and make buildings out of it. It's called drywall. And then what did we do with the hydrofluoric acid? It'll eat holes in concrete. What are we going to do with that? Oh, let's tell them it's good for it and put it in the water. And unfortunately, they've managed to get our profession to agree with that. And with no training in toxicology, how would you, like, I had one guy said, well, how can it possibly, it's so little? A milligram? A milligram's little? A milligram's a lot.
Okay, other questions? Thoughts? Okay, let's go. Yep. Where? Raise your hand.
This is probably a dumb question, but I'm a hygienist and I could probably, can't see him. You said I could train to do ozone therapy, but I would need to do it under a dentist, right? Does that cost a lot of money? I can't do it independently. Can I? No?
Independently? Yeah,
Like
of course.
But then
You can come to the course.
I can go to the course, but then I can't use the knowledge without a dentist, right?
No,
working on
listen, hygienists practice on their own. Many hygienists have their own practices up through Maine, and they're all using ozone.
How much is that machine?
I don't know. I mean, it comes as a dental kit. I don't sell them, but it's probably the whole kit, which, we go over the whole 2 days. It's probably about $6,000. Yeah.
It's well worth it.
Yeah, but that's everything you need, with ozone, because over the years, we never knew what the hell we needed until finally with Roger Chown. First of all, the instrument has to be safe and effective. Everything has to be completely ozone resistant. That means there's silicone, what's called kynar, and quartz. You don't want an ozone generator that has a metal conduction tube or plastic ends. I've got calls, my ozone generator's on fire. And I'm like, okay. Have I trained you? No, but I heard you know about it. Well, is it on fire now? Yeah, well, unplug it. Get the hell out of the office. Because they have plastic stuff. So it's important that, believe me, the few dollars, which is inexpensive in the world of dentistry, the investment, the comeback, what happens is that you're so dependent on it. Meaning, in other words, you make ozonated water, which is very simple to make. If you have those tanks that you put on your units, you load it up with ozonated water every day. You'll have no biofilm in your units. You'll actually be cleaning the oral cavity and the prep as you go, disinfect, and you don't have to breathe all the crap. So, and then once again, if you have, for example, you have a pulp exposure, okay? What kills the pulp? Is it the exposure or the infection? It's the infection. So with the ozone, the proper concentration, you ozonate that little wound, put your little Band-Aid on, treat it, seal it, and forget it. The tooth heals itself. That's been proven scientifically numerous times.
One question about Hi. A question about the ozonated water on the bottles and like on my Cavitron unit and stuff. Would it corrode any of the plastic or the pieces?
It could explode. No. Okay. No.
No. Okay.
No, because the dental units, most everything is really, the plastics are pretty hard, and also most things are silicone.
Okay.
So I've been using the ozonated water units for years with no corrosion or breakdown itself. Okay?
Thank you.
You're welcome. And you're talking about trays before. What's important is that when you're doing the ozone trays, is that you bubble the ozone through water first. Make sure it's moisturized. Okay? Because you don't want, because when the ozone comes out of the unit itself, it's very warm and dry. And ozone loves to have a moisturized environment to travel through the tissue itself on the trays. And also the way we set up the trays is it's kind of like a simple 8-step procedure, but what you do is, you have the ozone coming into the tray and one going out. And Griff was talking about the going out. You can either just go out to the destructor, which is a permanganate, okay, converts the ozone back to oxygen, or in your high-speed evacuation, but keep it super low. But what's important is that the saliva ejector, that's what you put in the middle. That's your safety valve, okay? Because patients do dopey things, and they'll leave some ozone. But and once again, saliva ejector goes in the middle as a safety valve. But also, it's a very low flow. Remember, and one of the keys I talk about in the course, it's not the volume of ozone gas, oxygen ozone gas, that counts. It's the concentration and time. That's the key for all of these things when you have managed ozone therapy. You don't need a hurricane, coming in. I mean, when we're doing trays, I'm putting, like a 1/4 liter per minute gas. But we're maintaining a specific ecological environment there at this particular concentration over X period of time. And that's when you get the effect. Not the volume of the gas, but the concentration and time. And that's where you see the incredible effects that you get. So all those principles I spoke about, those fundamental concepts, that's what you see in your soft tissue management. For perio, it's like a field day. Hygienists love it because the response is so incredible and quick, from that. And, we talk about irrigation. You get to do all the cool things with ozone with perio. And, but the point is that even if you don't do the mechanics, say you're going to do one arch, you do the treatments with the ozone on the other arch. By the time they come back, holy smokes, all this shrunk back and you're just taking flaking things off. So it's soft tissue responds extremely well. Caries arrestment. You have a tooth that you're going to do a pulp exposure. The tooth is vital. Ozonate it. You'll oxidize it. You'll sterilize that dentin. It will remineralize from the inside out. And fine, you don't have to do the exposure. You get a negative exposure, that's fine. Treat it and set it and forget it. Okay. And also, pit and fissure sealant. You should never put in sealant on unless you ozonate it. Because it's all the things that we don't see is what screws up teeth. The ozone carries an electrical charge that's negative. Any kind of infection or positively, a positive charge is associated with that. So you have all these nooks and crannies in teeth, which we can't see. We think the big fissures are there, but there's a lot of other stuff. The ozone is at a molecular level. It will go into all those areas, and you'll have basically a sterilized tooth. Then you flow your sealant in. Now you've really done incredible service. Because we don't see over the years, we've all seen, wow, he had a sealant on, now it's all rotted out. We couldn't see those tiny little nooks and crannies in there. Okay, and they said, well, you cut off the oxygen and food to the tooth, that's why a sealant works. Well, they're anaerobes, and enamel has cracks in it, and from the odontoblast, the stuff leaks up and feeds them. Okay, so simple, anatomy. Okay, so once you do that, you ozonate it, boom, put sealants in, boom, then you really did a nice service for the kids, and that works really well. I won't even touch endo, but that's another story. Any other questions on that? Good. Hope you all get gas someday. I know Griff has a lot of gas. I'm sorry, I kind of let that out.
I do not. We have just the one online question?
That's one, yeah. I only got
Okay,
one.
from Amanda Smith. Is the iodine delivered as a gel and applied with a brush? Not typically. Typically, it's a liquid. You take your povidone iodine, you can put it in your irrigator or your scaler, and you can do subgingival cleaning that way. They could gargle with it. They do make some gels. I think there's one called Iodazorb or something like that, Dave. But that's usually for wounds and things. I don't think that's much for oral care. Am I speaking correctly on that? Okay, is there anything you want to add for Amanda about? So
Lugol's is edible. Povidone is not.
Right.
Well, and so, I can get a big jar of Lugol's and do the same thing with it, same program.
Okay, could she hear that? I mean, okay, so he likes Lugol's. That's not my favorite, but we all have it, and he's right. It's you can pretty much eat it. So, do you use it at all in your practice? I don't. Okay.